You've been a harsh self-critic.
Yes. In August, when it first started, or first was being reported, actually started much earlier in the year, we all thought it would burn out, just like it has since 1976 in all the previous cases, and we thought it would be contained and self-limited. The difference here is it was on the border between three countries, in urban areas with heavy transport hubs, and it spread much more rapidly than anyone had predicted.
What is a distinguishing feature, Dr. Emanuel, of the epidemiology versus HIV/AIDS or any other epidemics, pandemics that we've seen?
So for Ebola, you don't need sex to transmit it. It does happen by bodily fluids, just like HIV. It's not aerosolized, so you just can't breathe on someone. Here, one of the important elements appears, and it also kills much more rapidly than HIV. Obviously,
70%.
HIV it's not the number, it's the length of time. And the other thing, in this situation, one of the big problems is how people handle dead bodies and the fluids, because they're super concentrated with virus, and that's been a major reason that this has continued to spread. And again, one of the biggest problems here is just the fact that these countries are among the least developed, broken down health systems without basic things like gloves and masks. And that, I mean, we got all excited about ZMapp and curing someone, but the fact of the matter is gloves, masks, and personnel are the key items here, and we have to re-emphasize the basics over and over again.
And we're playing catch-up here with the IMF pledging a lot of money to the cause. The head of the World Health Organization, Margaret Chan, she used to head up Hong Kong's health department, so she has experience dealing with outbreaks like bird flu, like SARS. Shouldn't she have been handling this better? I mean, she was the one who actually turned down Ebola vaccine from GlaxoSmithKline.
So, I think all the experts got it wrong. I don't know of one person who really got it right. And I think the fundamental fact is we do have to, instead of focusing on vaccines, you've got to focus on what we can do. And the big thing that we can do is the basic health measures. And it does so. When I was in the White House, one of the things we did is to emphasize in the President's Global Health Initiative building up the healthcare infrastructure for a sustainable response. And this really is a very important element here. Hospitals, facilities, trained personnel are going to be the key to getting this solved. And as we now understand, it's going to take some time and several billions of dollars. But we should remember, in the larger context, I calculated out for an article I did for The Lancet, that this is like 1 penny in $100 of the American GDP. This is a very small amount of money for us. It's very important for the stability of West Africa, for the economies there, and to really get our arms around it so we don't have new democracies, which we've been nurturing along, collapse because of this. And as you pointed out, Camus said, he indicated how very fragile governments can be under these stresses.
Richard? It's going to be a real race, though. This thing is moving so quickly, as Zeke said, and to build bed capacity in hospitals might simply not be fast enough. We're going to have to look at some very difficult things, some low-tech things like getting the kits and protective gear for people at home, but also how do you quarantine people who have the disease or people who have died from it from people who are still healthy? It's going to require some very difficult public health choices.
So within the public health here, there's a dovetail with the military force.
And exactly right, Tom. 3,000 U.S. troops being sent there. Ezekiel, how safe are they?
Oh, I don't think the problem is exposure for them. I mean, they have been well trained. They do have gloves. They do have masks. They do have gowns, and they understand the situation. I think the real issue is whether 3,000 in the end in these various capacities is going to be enough. Remember, the other countries had limited health personnel to begin with, and a lot of those health personnel have been exposed and dying, and that, the limited number of personnel also turns out to be a problem. It's not like these countries have a big pool of healthcare workers.
Right.
Ezekiel, what numbers should we trust? The World Health Organization's 20,000. There was another number of 1.4 million.
CDC said 1.4 worst case scenario.
It's all over the place.
Well, the CDC's worst case scenario is if we don't respond in the next 3 months, and that number's for January. They show doubling every 15 to 20 days in Liberia, which is a scary thought. And they're urging action sooner rather than later, because one of the big problems is we do need to get our arms around it and to begin to contain it. And so I think the fact is, in their calculations, the CDC's calculations, they say that their underreporting is about by 2.5. So for every 10,000 people, it's really 25,000 people who've contracted the disease.
Ambassador Haass?
Let's pick up one other thing that was alluded to. This is not just a health crisis as big as it is. It's also potentially a national security crisis. We're worried about weak and failing states. If this were to spread to Nigeria, which already faces the threats from things like Boko Haram, this could be not just a human physical nightmare, but also a strategic nightmare. It makes the case for a real large-scale intervention.